Dear listeners, welcome to Faces of Digital Health, the podcast on how technologies are improving healthcare around the globe, with the mission of sharing insight to multiply ideas for worldwide healthcare improvement. I am your host, Tiasha Zaitz, and today you'll be listening about Estonia. You know, the tiny European country famous worldwide for its digital governance. If you want, you can even become an Estonian electronic resident and run your business from the country regardless of your country of residence. Healthcare-wise, 95% of healthcare data is in digital form, some of it supported with blockchain technology. But what does all this mean? Is data structured or is information stored in PDFs? How supportive is the system for digital health startups? And how did the country, where only 6.5% of the GDP is spent on healthcare, achieve the level of digitization many countries are only dreaming of? You will hear from Hannalore Taal, Digital Health Specialist and Chief e-Health Specialist at the Estonian Ministry of Social Affairs. And just before we begin, a quick invite. If you like the show, do leave a rating or a review in iTunes or on Twitter, when you can find me under @ZAJC_TJASA. See the recaps of other episodes on Faces of Digital Health Medium page or on the recently created Facebook page. Also, if you subscribe to the podcast, you will be notified about the next episode automatically. Now let's hear today's discussion. Hannalore, most people look at Estonia in astonishment regarding how you managed to create such a successful electronic infrastructure. You must be wondering the opposite. How come the rest of the world is so slow?
Yeah, it depends. When I have to introduce Estonian e-health and other digital systems, then always people are really surprised about the infrastructure we have. But on one hand, I believe that it probably looks better than it actually is. But because digital solutions are everywhere, and the data exchange in Estonia, it's implemented at a really good level. But otherwise, I think there are also other good countries that have innovated in that scene, like the Netherlands or other Scandinavian countries, for example.
One of the advantages Estonia has is the size. It only has 1.3 million people. Some cities even have more.
Yeah, and another thing is that when we started building our system, it was in the late 80s, then we didn't have the system in place. We didn't have anything, basically, but other countries that had their infrastructure in paper format. And in the 90s, when we started building our systems, then we could build it from scratch and use the ICT solutions. For example, Estonians never used fax machines and these kind of solutions for sending documents. So right away we could establish digital solutions.
Exactly. That's why some people say that developing countries are promising for digital health or anything else in a technological sense, because you don't have any existing structures or any existing systems that you would need to disrupt. You just start building from scratch, basically.
Yeah, that's true. That's true. And at the moment, people who have built our e-health systems are consulting countries like Kazakhstan and other developing nations that want to do it, and it's easier for them that they don't have to turn backs to their old systems, but can build it from scratch.
99% of health data in Estonia is digitized. Could we clarify that a little bit? So what kind of format is the data in? Is data structured, or are we only talking about PDFs? So documents in PDF format.
Actually, 95% of health data is digitized, and all citizens in Estonia have online health record. And by law, all doctors are mandated to transmit data to this health record. And the data that is gathered there are, for example, recent appointments, analysis, diagnosis, and also time-critical data, such as allergies, recent treatments, prescriptions, pregnancy, vaccinations. But to the central system, the epicrises are sent, and these are basically PDFs, yes.
And when was this put in place? Because if you, for example, if you have a country that's doing everything on paper and suddenly electronic healthcare records are implemented, only new data entries are going to be in a digital form. Probably the country is not going to decide for an investment to put all the archives in a digital form.
We implemented our nationwide health record in 2008, and since then we have digital data, but old records aren't digitized.
You already mentioned a few of the data points that are available in the digital form. So, for example, in an emergency situation, a doctor can use a patient's ID code to read time-critical information such as blood type, allergies, recent treatments, and so on. And I saw that the system compiles these data types in national statistics, so the ministry can measure health trends and track epidemics. So if we go back for a second, you mentioned that a lot of documents are still in the PDFs. Do you know by any chance how the analyses are done, and how is data privacy ensured in these cases?
The analysis is done retrospectively, that there's no real-time analysis as the documents are in PDF format, but we hope that with the machine learning also this kind of data will be possible to be analyzed. But in Estonia, National Institute for Health Development is doing the statistics, and the secondary use of data is done with anonymized data. And also Health Board is doing investigations with the health data. For example, in the winter when it's the influenza period, then they are not tracking the information from a health record and health system, but rather from GPs and from their databases, and they can tell the trends of influenza and for this kind of problems.
Do patients need to give any type of consent for their data to be analyzed, or is it anonymized, and is it an obligation to let your data be analyzed?
The data is anonymized, and for statistics, patients don't have to give consent, but patients can opt out from the system, meaning that when they don't want that a certain doctor sees their data, they can remove the consent from a certain doctor in the patient portal.
You said that the digitization started in 2008, so you've got more than 10 years of data. I imagine that a lot of researchers or maybe companies would be interested in tapping in this data for simulation models or for other purposes, even if the data is anonymized. Do you get any such requests?
Yeah, definitely. We get the requests for research and from different companies, and the process is in place, but there's no system for patients giving consent in health record to give their data to third parties. But for example, startups and other innovators that would like to build their solutions and test their solutions based on that data. But at the moment, we are working on that to build the system that patients can give the consent, that third parties can have access to health information in the health information system.
So at the moment, third parties or startups can't really access the patients that they would like to, or they can through the national procedure that you mentioned?
Yeah, they can do it by applying for it. It's not really easy process at the moment, but we are working on it to really empower patients and have them access to do anything with their data.
We've seen a rise of blockchain solutions in the last few years, especially last year was strong. And Estonia actually is using blockchain to a certain extent also for the healthcare data. Can you elaborate a little bit on the use case, how it looks in practice?
In Estonia, we are using KSI blockchain technology to ensure data integrity and mitigate internal threats to data. And in our e-health system, all actions leave an unchangeable and irremovable secure trail, meaning that we can trace back to all the actions that have been done in health system, and every patient can see who has looked at their data. And the blockchain, the KSI blockchain technology is used to ensure that these trails cannot be tampered with. So, in Estonia, for example, if I as a patient see that some doctor or other party has accessed my data without a need to do so, then I can send a request and actions will be taken.
Do you know how often that actually happens? That patients would detect a breach in their data and would want some repercussions taken?
I'm actually not really sure how often it happens, but I know that in media there have been cases when some famous person or politician has been at the hospital, and if some nurse or other doctor has accessed the data, then there have been cases that people lose their jobs due to that.
By the way, I visited the patient portal where you can access all your health data, and I saw that it's also available in English. Is that because there's so much focus from foreign countries on Estonia and how well you're doing the digitization, or are people actually using the English portal? Do you by any chance know?
And I guess there are two reasons. One is definitely that Estonia is famous for its e-health, and probably we want to show also other countries that we have the portal who has the interest. But the other thing is also that in the past years we have many foreign workers for different countries. So I guess it's also the reason why the system is in English. And Estonia is a very small country that we have only 65% of the people are speaking Estonian, 28 speak Russian. So I guess it's probably also for them. I'm not sure if the system is in Russian actually, but...
Also, among other things, what Estonia offers to anyone on the globe is the e-residency. So even if you're not an Estonian, you can become a resident in Estonia and open a company there. Is it? Does that give you any access to healthcare as well, or the electronic systems?
I think definitely that as an e-resident you can access the patient portal, but probably you won't have much information there when you haven't visited a doctor in Estonia. Yeah, but I guess you have access to e-health systems as well.
I also went to read a little bit on the reports regarding the Estonian healthcare system, because when it comes to digitization, I was curious to see what's the health status of the people in Estonia. And among other things, Estonians have witnessed the strongest gains in life expectancy of all EU countries, particularly after age 65. However, the healthy years are not expanding maybe as much as in other countries. So deaths from cardiovascular diseases have fallen sharply, but along with cancer and external causes remain the leading cause of mortality. Also, the proportion of people reporting that they are in good health is among the lowest in EU, with the largest gap between rich and poor in any country. So I'm really wondering, how does all the digitization and technology that you have implemented, how is that helping, or how does it fit into the idea of better health outcomes? How do you see that?
I guess that the e-health system is helping the people that want to be helped, meaning that we have different generations, like in all the countries, and I guess our older generation is not really familiar with the e-health system, and their digital health literacy is not as good as it could be, and they don't benefit as much from the system as the young people. But one e-solution that is definitely helping health outcomes is the drug-drug interaction system that we have in place, that when the doctor wants to prescribe a medicine to a patient, they see if a patient has an interacting drug. So I guess it has definitely helped our system. But we know that the quality of life is a problem in Estonia, and this has definitely to do with lifestyle and smoking and eating habits. So
public health issues are not necessarily the same as the technological problems.
Yeah, I personally really hope that patients will be more empowered in the following years, and also in older age will let the digital solutions to support them. But we as a country, we have to find means to approach these patients. For example, if we are talking about mHealth apps and smartphone solutions, then perhaps for older generations this can be just phone based. Then that for example, for medication adherence, the patient wouldn't get the notification on their smartphone, but a daily call that they have to take their medicine or measure their blood pressure. So as a country, we have to approach people in the ways that they are used to for communication.
How strong is the mHealth or the consumer health app ecosystem in Estonia? I saw that there's 65 companies in the Connected Health Estonia, but some countries like the NHS in England, they have special platforms where you've got applications that have been verified as clinically validated.
Yeah, actually, Orca, the company that is working in England, they are trying to enter Estonian market and do their verification system here. But we have different kinds of startups that are innovating in digital health arena, and some are successful, some are not. But I believe that you can be successful only when different stakeholders in healthcare system are collaborating. And I think you mentioned Connected Health. That they are financing some joint development programs between different stakeholders, between startups and hospitals, to develop the solutions. And also our health insurance fund is part of the Connected Health. And this year they are opening their innovation fund, that they are financing health innovations and startups that have already achieved the proof of concepts, but perhaps haven't been successful in implementing their solutions at a wider scale. So we are working on it, but as you mentioned, then in Estonia, the verification process for mHealth is not yet in place. And until now, we have been validating the solutions as we are validating drugs. or other medical devices. But this doesn't really work, and the health insurance fund, who is responsible for this process, is now designing the assessment framework to assess digital solutions and be able to get them faster in the system, and so the patients can start using them and the solutions are reimbursable.
What is the relationship between digital health startups, the health insurance fund, and the Ministry of Health? Because, for example, in Slovenia, the system is quite complex in the sense that you can't go directly to the insurance company to ask for a reimbursement from a digital solution, but you first have to go to the Ministry of Health, where the team of specialists needs to validate and assess your solution, and once that team validates your solution, the suggestion for the reimbursement can go to the health insurance company. So this is a really, really long process. That's why nobody really decides to do it.
In Estonia, companies can directly approach health insurance fund, and ministry doesn't deal with those reimbursement models or schemes. But the process is also lengthy. But this year, the process changed. That before it was that you have this application period only once in a year, and then during the next year, the insurance fund is assessing the applications, and in the end of the year will make the decisions. But now it's possible to apply 3 times per year, and as I mentioned, that the new assessment framework for health will be developed, so I hope that the system will be faster. But yeah.
You have a master's degree in healthcare technology. Have you ever considered to design any solutions yourself, or thought about going in digital health from a more entrepreneurial point of view?
Yeah, I'm actually involved in the digital health startup scene as well, because in the ministry I'm working on health position, and half of my time I'm working in a digital health company or startup, you might say, Cognius, and we have designed different solutions for patients as well, healthcare professionals. And one of them is a speech therapy platform that we also try to get in the list of reimbursed solutions by the health insurance fund, but in the first round we weren't successful, but we're definitely trying another time. But yeah, the business got better when we changed from healthcare technology to educational technology, and we started selling to schools and kindergartens instead. So at the moment the speech therapy platform is used by 50 different schools and kindergartens in Estonia, and we are thinking about entering also Polish market, as it's really similar and the problem is prevalent there as well.
Direct-to-consumer approach can be more successful in these types of solutions, and you can always go for reimbursement later on, even if you've got the interest from the market already.
Yeah, that's true.
By the way, you started your career in healthcare sector as a physiotherapist. Did you see any interesting digital health solutions in physiotherapy so far? The things that I know that are in development are various wearables where you can monitor how well and how accurately you're doing a specific exercise, so you're not just looking at a video, not knowing what you're doing wrong.
As a physiotherapist, actually, why I'm in this digital health sector and I started studying healthcare technology was that as a physiotherapist, I saw that at the time I can only treat one patient, but very often the patients are similar and they don't actually need to see me and they could do the exercises at home. So when I started studying healthcare technology, I right away, I wouldn't say that I started started a company, but we had a project that was called Physiobear, that you would also get sensors, and you could do exercising at home by just reporting your problem, and you would get a personalized exercise program. But we were just investigating the market and working on idea, but we saw that this is, it was in 2016, and it was already then really crowded. And as you mentioned, then there are so many different solutions for physiotherapy that you could put on the sensors, and they would say if you are doing the exercise in the right way. But definitely, I think it's very useful, but sensors are still quite expensive, so I'm not sure how much like normal people are benefiting from these startups' ideas.
Yeah, a lot of ideas still need validation or maybe a broader scale testing.
But I guess they work, but they're just a bit expensive at the moment. That for healthcare system, it's still cheaper to send the patient to see a physiotherapist rather than prescribe them sensors and a solution.
Yeah. One comment, perhaps, the amount of GDP attributed to healthcare in Estonia is 6.5%. That's way lower than the EU average, which is around 9.9%. How do you see that? Do you think that's problematic? Some would say that Estonia is just being efficient. Others would claim that, yes, you're attributing a little money to healthcare, but a lot of things could be improved if more was invested.
This, as you say, it can be justified and argued in different ways, but one thing I believe is that in general in Estonia there isn't too much money, and the salaries of healthcare professionals are especially low. But I think that even though it would be really good if our doctors and nurses would get higher payments, then the whole system wouldn't be more efficient because of that. I would definitely support the idea of putting more money into healthcare in Estonia, but then to rethink the reimbursement, the financing model. Because at the moment we have fee-for-service and DRGs in place, but we really need to shift to value-based healthcare, because in some areas of healthcare system, a lot of waste is being done, and lots of money is wasted without patients benefiting from these euros. So we need to put more money into healthcare, but just money won't help. We need to rethink our processes and how we are doing things and financing them.
Exactly. By the way, are you suffering any brain drain because the salaries are low and doctors are valued all over the world?
It was worse during the financial crisis in 2010, and so doctors were going to Finland. But just in the news today, I read that now it's dropping, and more doctors, after graduating, they remain in Estonia. But yes, of course, we have the tendency that our doctors go to Finland, but then doctors from Finland are going to Sweden, and from Sweden to Norway. And we welcome the doctors from Ukraine, so I guess this professional tourism won't go anywhere. But yeah, I was really happy when I saw that more and more professionals are remaining in Estonia after graduating.
How would you assess the quality of life in general in Estonia? That's one major factor that can contribute to a decision if you, as an inhabitant of a state, will stay in a country or not.
Yeah, this is really long, and our country is doing a lot to ensure that we have next generations of happy people. But I would say that in the cities, the quality of life has increased a lot, but we have strong regional differences that in rural areas and in the east of the country and in the south, the quality of life is not as good, and it's also seen in different factors that they are lacking behind, that the lifestyle isn't as good there, and people don't have as much jobs. So in general, I think that the quality of life is higher in the cities. That I would say life in the countryside in Estonia can be a bit depressing, unfortunately. Also, I believe the reason that more and more people are moving to cities is the reason why we have this kind of digital solutions, that we can't provide services for people in the countryside and on the islands. We have many islands in Estonia, so you have to have e-state to provide state services to all the citizens.
Many problems still to solve. Do you have any thoughts on further development of digital health in Estonia? What other systems are you looking at? What inspires you in digital health space? What do you look forward to?
In Estonia, the major thing at the moment is the personalized medicine, and around 150,000 patients have given their genetic tests that are being analyzed at the moment. So I guess as a country we hope a lot from this, but we can't be naive and think that we could benefit from it right away, but certainly it will take some years. But personally, I would really like to see that Estonian people would get empowered by digital health, because only in that way I think our system can improve, that people take the responsibility over their health and start fixing their lifestyle, because I think it's the history that healthcare only happens in hospitals and doctor offices, that health is around us, and we as citizens can do the most for ourselves.
This was the 35th episode of Faces of Digital Health. The next one will be published in 2 weeks, this time on the potentials of AI in aging. Stay tuned.